literally walking distance from here. Been here 17 years. Talk from one of the smallest practices up on the largest and one of the most average. So we're about 7,500 mark in that practice. Got lots of different roles, but the one I really like is I host a radio show at Tameside Radio on Tuesday between 2 and 3 o'clock. If you ever want to listen to it, it's where health advice is given out to the population. Apparently, we've got 17,000 listeners. Anyway, I wanted to say, if you want to make a difference to people and the population, careful to look out for the things you can't see and think about the things that make us poorly. So if you take a queue at my reception desk, okay, in the morning, there'll be something like, on average, work this out, 5 children with viral illnesses, probably 7 this time of year now, 6 adults with long-term conditions, one of those has got cancer or surviving the cancer. There'll be 4 or 5 people anxious or depressed. There'll be a couple of people asking for admin help, things like housing letters, sick notes, benefits, etc. One of those people will be recovering from an operation. There'll be one person going for conception or pregnancy. A couple of urinary infections, and perhaps one person with a chest infection. So that's kind of the average kind of mixed at reception desk. And all those people will probably be saying to themselves, I'm a priority, I'm poorly, I need to see somebody. And the cry goes out quite often, I can't get an appointment, it's convenient to me, the waiting time's too long, etc. But I'm going to be slightly controversial and argue that that queue at the reception desk, you probably need to do less for. You probably need to do either that, or do things for them in a different way, which takes less time and less resources. And why is because my practice is opposite one of those estates where you don't like to walk down late at night. And the last 10 years, those 300 houses on one single road opposite my practice, there's been, over the last 10 years, there's been 3 suicides, 1 accidental drowning of a child, dozens of premature deaths because of drugs and alcohol. I can't tell you the number of child protection cases we've had for abuse, neglect, and sexualisation of children that's happened on that road, single road. There's beatings, there's intoxications. There's one lady we discovered who was one of those classic hoarders you see on TV, had house piled high, impossible to move around, where there were rats living alongside her. And actually, when we got into the house, we found that she was living with her daughter who had learning disabilities that we didn't know about. There's been fights, there's fractures and everything. There was one woman, sorry if you haven't had a meal yet, but one woman who was actually nailed to a door by her so-called friends for fun when they were high on drugs and alcohol. And then one young man who was so out of shape and unhealthy that unfortunately he slipped at home and died. And the only reason why we found him eventually was, I don't want to do this ever again in my life, breaking down the door with the police to find somebody partially decomposed on the floor. And if you want to make a difference, those people very often are not coming to your reception desk. They're not there all the time. And amongst all those people, there are dozens and dozens and dozens of lonely, elderly people with complex conditions who don't come forward. So, my response to the people at the reception desk saying, I've got priority cases, actually I can see you, you're looking all right, but out there in the community, there are all these other things happening. And if you want to make a difference, I'd say to people, especially during this debate, look out for the things you really can't see, and think about the things that make us poorly in the first place. We're going to need a different response than what we're having at the moment in order to have a healthier way of living to make the health of Tameside better and improve.